everyone. So I thought it was about time that I did a update video. I know that I haven't done one in 6 months, and I've had a lot of questions, as always, asking how I'm doing, how my health is, what sorts of things I'm getting up to. So it's been a busy 6 months. My last video, you'll probably remember, I had broken my knee and just had knee surgery. So that's all healing really nicely. I'm now walking again without crutches. I did some physio and I'm much better now. So I am walking about 3 miles a day, which is brilliant because I love walking. Health-wise, in terms of my cancer, I don't have any news for that side of things. I am still no evidence of disease, have been now for three years and 3 months, which is fantastic news. So I still have 6 monthly check-ins with my oncologist, and my bloods are coming back normal. I don't have another appointment until October. So there's nothing to suggest that my cancer is coming back. So that is brilliant. I've just got to make it to 5 years. Because of my BRCA1 status, I still have certain things that I have to keep an eye out for. So I'm still at risk for ovarian cancer and skin cancer. So I have yearly scans of my ovaries. So I had my last scan of my ovary in December of 2020, and they told us that we are ovulating, or I am ovulating. So we have been trying for a baby for a good sort of 18 months, my partner and I. So that's partly my big news, and the reason for sharing this video is that we are expecting a post-cancer baby in September. So we have a bit of a bump going on. Quite a bit of a bump going on. So I am currently 8 months pregnant, and it has been a bit of a up and down road with this pregnancy. So you may or may not know that I'm already a mother to a 14-year-old, so there's quite a gap between my two. I had my son when I was quite young. So we have been trying for a baby for a couple of years now, really, and nothing was happening. So we were sort of thinking, my oncologist suggested it might have been the chemo, even though my cycles were regular. And it was a surprise to us to find out that I was ovulating, and that was just luck of the draw. Just happened to have my ovarian cancer ultrasound check on exactly the right day to suggest that we were ovulating, and we just happened to catch, which was really, really exciting news. So the first 3 months were a bit of a challenge. I was quite poorly in the sense that I wasn't sick, but I had constant nausea, which was very different to my first pregnancy. So it was a bit of a shock. We were also buying a house at the time. So we have moved. So we bought a house in the end of February this year. So I was about 12 weeks pregnant when we moved, which I wouldn't suggest to anyone, but it's better than moving now, I suppose. So because of my cancer status, or my sort of survivor status, should I say, I have been flagged as a high-risk pregnancy. So the reasons for that are just kind of my age, because I am 38, so I'm classed as a mother of advanced age, or what used to be termed a geriatric mother, which was a bit of a kick in the teeth. But also because I've had 6 surgeries over the last 3 years, that was really quite a big concern for them, how my body was going to cope. Luckily my cancer was triple negative, so I have not had to take any ongoing treatment. I haven't had any tamoxifen or Herceptin or anything like that, so I really am quite lucky in the sense I haven't had to stop any treatment to try and conceive. And because my cancer was triple negative, it doesn't respond to the pregnancy hormones that maybe a progesterone positive or an estrogen positive cancer survivor would be dealing with. So I have had regular appointments with my new consultant, my obstetrician, because here in the UK you only have an obstetrician if you are classed as high risk. Normally you would be midwife led. So I have had appointments with my midwife and my consultant. So at the beginning of the pregnancy, I had an appointment with my consultant at about 16 weeks. So they've kept a good track on my bloods. Shortly after my 16-week scan, they sent me for an echocardiogram, so a heart scan. So one of the issues with my chemo that I took, which was FEC-T, is that it can have lasting damage to the heart. And sometimes that damage can go unnoticed and unchecked. But because you have an extra load when you're pregnant, extra blood going through your system, extra weight, extra oxygen requirements, it can then put that extra load onto the heart, which would then potentially show up some issues. So I was scanned at 16 weeks and it came back as normal, which was fantastic. I was then admitted at around 24 weeks, I think, for a hospital stay. That was through the maternity triage unit. So I was experiencing quite drastic shortness of breath, which you can probably hear. I struggle a lot to talk. And that was the case from very early on, from sort of 22 weeks. So they admitted me. They were a bit concerned that I might have a blood clot. Simply because of the treatment that I've had, it can affect the blood in the long term. Luckily, all the scans came back. So I had a chest X-ray. I had some sort of, I can't even remember what it was called, some sort of lung scan to check if I had any blood clots. They also did an echocardiogram to check if my heart was coping again, which it was fine. And they just kind of put it down to potentially being my scar tissue from my double mastectomy. So because of the way the baby grows, obviously it places pressure on your diaphragm and everything kind of moves up. Now in a normal person, your lungs can still kind of expand out, but because I am scar tissue from probably here, right across to under my armpits and right across to just over my bump now, there isn't as much movement and expansion ability for my lungs. So they are keeping a really close eye on me in terms of my oxygen levels. So I have to have my oxygen taken at my midwife appointments, as well as my blood pressure. So that was an overnight stay at 24 weeks. I then have had another echocardiogram, so I've had 3 so far. And that was this week actually, and that's come back as normal, which is fantastic. We're really pleased. Now the other thing that they've done is they put me on blood thinning injections. So that is just to decrease my chance of a blood clot. Again, because there's something about how the chemo has affected the blood, my age, little things like that. So I have been on daily blood thinning injections, which are called Clexane, which are the ones that I was on when I was on chemo. So I am familiar with taking them, luckily. So on those daily until baby arrives, and then 6 weeks after. I'm now 32 weeks pregnant, so we are expecting baby to arrive anytime in the next 8 weeks. They're not going to let me go over for various reasons, so I am due to talk to my consultant in a couple of weeks part-time about my birth plan, because they might want me to go for a elective cesarean. Baby is growing normally. There were concerns about how the placenta might develop, whether that would affect the baby's development, but they've kept a very close eye on it. I've had a scan at 12 weeks and 20 weeks, which is normal for UK pregnancies. I've also had a growth scan at 28 weeks. Everything was fine. I've got one at 33 weeks and then at 37 weeks as well. So depending on how baby is growing, he or she is fine at the moment. We don't know, it's a surprise, the gender. So yeah, so it's all been a bit of a whirlwind, a wonderful whirlwind. We're very, very pleased to be able to have a baby after chemo. Obviously there was a very big question mark about how it had affected my fertility, whether it was going to happen for us, and we kind of had written it off and thought it might just not happen, and we weren't willing to go down the IVF route. So that is really all my news. I seem to have big updates when I do my updates. So health-wise, I'm absolutely fine. Pregnant, fat, and in the middle of a UK heat wave. I'm not particularly comfortable. However, I am pregnant, so it is wonderful news and great news that I'm able to share this with you guys as well. And that's about it really. Just hoping to have as normal a delivery as possible. And that's about it. So thank you ever so much for watching. Please ask any questions if you want. I'm happy to do update videos. And I will try and do an update video once little one arrives, just to show you and for you to meet them.